The hip flexor stretch is an imperative part of the home exercise program when we're trying to really open up that anterior capsule of the hips, open up the hip flexors, and really elongate that whole anterior tissue of the front of the hip. And there's a lot of cool things that we can do with this to really accentuate different parts of the hip capsule as well. So the first part of this stretch is we want to get the patient half kneeling on a comfortable pad on their knee into a forward half kneeling lunge position. Then want her to pelvic tilt so we can really fix that lumbar spine. And I'm going to have her just gently lunge forward, keeping the body and the torso straight, making sure the lumbar spine doesn't arch. And so we get a nice stretch on the front of her hip, right here. Okay? We can also give her manually a little bit of a PA pressure to make sure she's really loading that anterior hip capsule. Okay? If you find that the patient is very tight in internal rotation, it's beneficial to really take this leg and actually bring her into internal rotation here, which you can see Alana's pretty stiff here. Okay? So we're gently internally rotating that hip and again keeping that intercapsule extended. If we want to open up the left lateral oblique and elongate some of the TFL tissue, we can have her lift the arm up and do a right side bend. Okay, so we're continuously stretching the anterior capsule. We're making sure that the lumbar spine is tight. We're keeping the foot into internal rotation so we can stretch the internal capsule of the hip as well. And she can hold that position for about 30 seconds. And you can do this both in the clinic and assign this to the patient for a home exercise program.